Ready, set, go.
Ready.
Okay, so we're back. We've warmed up the quads and the sartorius and the TFL and IT band. Okay, so now I'm going to move into adductors and we'll do a little bit of psoas work. Okay, so adductors are on the medial portion of the thigh. Okay, they adduct, so they bring towards the midline. And what I like to do when I work adductors specifically is first and foremost I'll tuck underneath her leg, and then I also like to kind of figure four almost her leg out, and I'm going to actually adjust this bolster out a little bit. Okay, this is where those, sorry, I'm going to bring your leg off that bolster. The long ones are nice for this because they still go the length of the table. Okay, so I do this, I bring the bolster out for comfort of the client, right, so that when you're working on the inside of this thigh, her knee isn't bouncing up and down, and anyways. Okay, so now we have the inside inner thigh exposed. Okay, we might have assessed a few things when I was warming up the entire quad and thigh. I was saying that I thought the adductors were tight. So we're just going to come in here and sort of do some fine tuning. So effleurage, long strokes. Okay, we can do some petrissage and kneading in here too. But I feel that her adductors are definitely tight. So more of what adductor work is a little bit more specific, almost localized cross fiber. So I'm going to find tight spots and put pressure in with my fingers and either go back and forth long ways up and down her thigh or sideways.
Is that all the adductors right there, or is it a particular one?
The one that I'm working on right now is probably the gracilis. Okay, so the gracilis runs the entire length here. Okay, but you can feel as you run your fingers and your hands up towards their hip, you feel how the tissue gets so much thicker there because there's those 5 muscles situated up here. Okay, so same thing as you kind of come outside a little bit. Sometimes I prefer to use a little bit of my thumb. I know you shouldn't necessarily, but I just think that I get a better handle and better angle on working those adductors. Okay, we can see her skin's getting a little bit pink, so there's blood flowing there, which is good too. I also prefer to use more of my forearm, just because it's a little bit easier to get in here. So nice deep strokes. Just be careful too. This can be a lot of very tender on people. You okay, Hal? Okay. All the way up through the whole length here. Okay, similarly too, like I showed you guys for the IT band, you can do some of that opposite pulling and pushing up here too. This always feels really nice, and this is a good assessing tool as well. You can kind of feel which muscles or areas might be tight. She's loosened up pretty good just with that. Okay, so that's the adductors. I'm going to bring her back to center here, adjust the bolster. And then we're going to move into psoas. So I'm going to show a few things supine and a few things on the side. So first and foremost, the psoas, of course, comes on the inside of the ilium. Okay, we have the iliac fossa, and so let me grab this guy. So the iliac fossa in here, the psoas comes from the lower lumbar transverse processes on the inside, and then down through this little notch here and attaches at the lesser trochanter down here. Okay, so hip flexor, low back stabilizer. We also have the iliacus that just comes from the inside of the iliac fossa and again down to that lesser trochanter. Okay, so it's a little bit difficult to get to, but first of all, It's going to be good to work that area we worked for the rectus femoris just off into that AIIS. That'll get a little bit of that muscle too, so working through there. The biggest thing that I do when the client is supine is I kind of curl my fingers around that iliac crest. Okay, and then I use some breathing techniques to get deeper in there. So I'll say, Holly, take a nice deep breath in. Okay, I'm keeping my fingers where they are. As she exhales, I'm going to sink my fingers and curl them underneath that iliac crest. Okay, and then I'll stay there and say, take another deep breath in. And on the exhale, I curl a little bit more. Again, people with really tight psoas, this is going to be tough for them. Another deep breath in. And third exhale, I'm going to go as deep as I can and as she lets me. And on her next inhale, I'm going to come away and I'll do some hip jostling here to loosen up.
Are you just holding your fingers in there, or are you actually moving them when you're...
I'm curling and then I'm just pushing deeper.
Pushing.
Yeah, on the exhale. Good question. You can, on the next one I'm going to show you, you can do a little bit of like a cross fiber or movement with your thumb when you're in there, but it just depends on what your client can handle. Okay? So this next one, we'll do this one two ways. We'll do it both supine and side lying. You'll kind of access different parts of the muscle both ways. Okay, so what I'm going to do is I'm going to grab and tuck here. Okay, I'm going to grab underneath her quad or her thigh, and I'm going to just tell her to relax her leg. Okay, so I don't want her engaging that psoas by trying to flex it up and help me. And then I'm going to put my thumb in that area just on the inside of the ASIS. Okay, so right in here, this area here, I'm curling my thumb like this on the inside there. Okay, and then I'm going to lift her up a little bit. And again, this is not something that you do on every client, so it'll be a little bit more strenuous on your part. And same thing, I'm going to work with her with breathing. So take a nice deep breath in, Holly. And on the exhale, I'm going to create the action of the muscle, flex her hip forward, and dig my finger deeper. Okay. Inhale. Okay, hold it there. Exhale, a little bit deeper. You okay?
Mm-hmm.
Okay, and this Indre, like I said, once you're in here, you can move your thumb a little bit back and forth, up and down, sort of little circles in there to work those fibers. Okay, and then we kind of let her go. Same thing, do a little bit of jostling. I like to do this stretch after that, straight out from the bottom. How you feeling, okay?
Awesome.
All right. So just to review, we've got the adductors, kind of figure 4 their knee out, adjust the bolster if you can, work really specifically through there. And then we've got the psoas curl, we'll call it, where you're curling around the iliac crest, work with their breathing, and then the actual lifting up their thigh and flexing the hip while you're getting deep into that psoas area. Okay?